I created the GordoTEK YouTube channel to provide a place for educational videos about psychedelics. I review published research and try to make it more accessible to lay people. Today I'm going to be doing something a bit different. I'll be speaking with the CEO of a company that is directly involved in DMT research and clinical trials so we can learn more about what is happening in the field. So with that said, let me introduce our guest today, Timothy Coe, CEO of Entheon Biomedical. Entheon is a publicly traded company headquartered in Vancouver, Canada. They are focused on bringing psychedelic assisted treatments to the world of modern medicine with a near term goal of treating addiction, specifically by using DMT in a clinical setting. This is exciting to me because it seems that very few researchers are focused on medicinal DMT right now. So, Timothy, please tell us more about your background and how you came to this point in your life as CEO of a company that is focused on psychedelic medicine.
Yeah, totally. It's a long background, depending how far back you want to go. I think it encapsulates my entire life narrative and familial history, and we'll get to. But prior to this, I was in a whole bunch of different entrepreneurial ventures, as in another disruptive space, blockchain. We were trying to democratize sort of crowdfunding, enabling sort of microtransactions and sort of like a collective charity model, among other things. And prior to that, still worked in a bunch of private ventures with my family. And then, I think vocationally, I trained to be a poet. So before any of this business stuff happened, I always just had an interest in, articulating the, virtues of existence, all the good, the bad, the sour, and the sweet. So that was always sort of in my mind. But yeah, no, what actually brought me to the formation of Entheon was, again, my personal story. I lost my brother to addiction in March of 2019. And that was like, it wasn't an instantaneous event. It took shape over the course of, over 20 years. And even before drugs entered the picture, it took into account all the various, pressures of living within a certain type of household. We're second generation, Asian Canadian kids, and so there are a lot of integration pressures as well as familial pressures, etc. And some pretty traumatic stuff happened to my brother in his teens, and he wasn't able to leave the house for 5 years. It was a sort of medical incident, and so yeah, something that happened during that time is that he found drugs to self-medicate and self-soothe, and they were useful in sort of suppressing the distress and discomfort of not being able to engage in the social fabric. But over time, like as those internal issues of like self-perception as well as isolation, alienation from society compounded, it continued to metastasize into an untreated illness that he was momentarily and temporarily treating with drugs like crack cocaine and heroin and ultimately fentanyl. And then, yeah, so I became responsible for my brother's care about 3 or 4 years ago. After my parents just threw up their hands and said, "We don't know what to do. We don't know what's enabling. We don't know what's helping." And so, yeah, I got my brother into a bunch of drug treatment centers. He was kicked out. He flunked out. He wound up on the street. He wound up in mental health institutions. And during that whole time, he was medicated to the point where he could barely talk. Methadone, Suboxone, antidepressants, anxiolytics, mood stabilizers, antipsychotics, anticonvulsives, all sorts of things, which does represent like, the earnest efforts of a very limited medical community. They do really care, and there are hundreds of mental health professionals really tried to help my brother and even cried for my brother, but the tools that they had at their disposal didn't address that complex milieu of psychological and emotional things that develops over time. Rather, there's a lot of symptom management about stabilizing, getting a person to a point where they're no longer seeking drugs, just from a pharmacological perspective, like with methadone and Suboxone. But ultimately, a lot of that internal condition didn't change. And so we lost him to an overdose. And from my personal history, I know I'm going a bit long here, but
No, it's
I,
good background. And,
yeah.
and my condolences to you regarding your brother. I'm sure that's a powerful motivation for you. And I hope that you end up ultimately honoring his memory by helping countless other people that are struggling with addiction.
Yeah, I'm absolutely trying, and yeah, it's a sort of balance. Like what went into this, the drive to create this was that understanding the the suffering that my brother faced, and he sincerely wanted to get better. He would sit there and like look at me, say, "I'm trying, Tim. I'm really trying." And that was really difficult to witness and be part of. And like as a family there's a lot of suffering, and it's just like not just our family, there's thousands, millions of other families that suffer like that, and they really do like are willing to spend anything or willing to do anything to facilitate some sort of change, because all they want for their kids is some semblance of safety and happiness. um, but yeah, like the tools that are available right now just simply don't do it. And my personally, I grew up in the same household that built my brother, and so I was doing some pretty intensive trauma therapies, and I guess at this point, 9 or 10 years ago, EMDR, cognitive behavioral therapy, and I hit a brick wall too, and I was in fight or flight. Like as try as they might, my therapist just couldn't get me through this. I was always in a state of anger, aggression, or a sense of hypervigilance. And a friend introduced DMT to me. It wasn't my first trip with psychedelics, but it was my first trip with that. And yeah, in a non-directed, sort of self-directed way, I self-administered a good number of times over the course of about a week and a half. And it really did help me reconfigure all these blockages and sticking points I had about how I perceive myself, how I perceive myself in the world, what it meant to be a man, a son, a brother, a friend. And ideas about expectation for myself really did sort of profoundly reorder that stuff. And so, yeah, I linked those two. And then knowing that just those two components isn't enough to build a business. And so, pretty quickly, so I sought out the smartest, most researched people in the world, and they comprise our advisory team. And I think a lot of your viewers will probably know some of the names like Matthew Johnson, Robin Card Harris, to really validate that psychedelics could help people with substance use disorder issues. And then going deeper than that, well, what molecules are best to use and how do you best deliver them? And this is the business of Entheon.
Right. Okay, gotcha. Yeah, I've heard a lot of testimonies like yours. Since I started my channel, people email me all the time saying that this or that psychedelic cured their depression or helped them with addiction. So I know without a doubt there's a lot of potential there, and it's really exciting to me to see it, going through the scientific rigor now, and all these companies getting started, and the universities doing research, and really discovering what a lot of us, hobbyists have known for decades, of course. Um, so was the company just, I see that it just started trading publicly, I think this month actually. Was it founded before then?
Yeah, we started trading in November, and that didn't happen overnight either. That was a pretty arduous regulatory and sort of legal process that we had to engage in. No, the company formed in about June or July of 2019.
Okay.
Following my brother's death, I was sort of understandably shocked, but also really quite, I guess, agitated and motivated, I guess, out of that agitation. And yeah, it didn't happen overnight. There was a whole iterative process about consulting with our advisors and other professionals to understand, hey, what is the regulatory matrix that we need to navigate, and then within that, from a basis of research, what are some molecules that we could that have the highest likelihood and highest usability, and yeah, what we arrived at over time was DMT.
Yeah, I want to ask you about that. So it looks like Entheon is first targeting smoking cessation as their first clinical trial. And I know I'm aware of the tremendous preliminary results from Johns Hopkins using psilocybin for smoking cessation.
Mhm.
Um, I'm just curious, do you know of any previous research that specifically used DMT for smoking cessation, or will you guys be kind of forging ahead on your own in that regard?
Yeah, we are somewhat pioneering in that sense, but I do think, collectively we understand that the type of introspective insights and sort of reframing and recontextualizing of motivations, as well as like, yeah, just having a conscious view about, the impact of certain behaviors. These things are achievable from the effects of, classical psychedelics. I know there's, different visual intensities and different sort of somatic effects to various psychedelics. But we understand that the appropriate like default mode network dysregulation and stuff is achievable with DMT. But we think that DMT is potentially a more useful therapeutic molecule in that, rather than locking someone into a 6 to 8 hour long experience, which is generally perceived as being, overall good, even the good, the bad, the challenging, and whatnot. We think that with DMT, from the perspective of safety, as well as scalability, can elicit these profound introspective journeys and really help a person recontextualize who they are, but do so in such a way that the sort of duration length of that experience can be shortened from potentially 6 to 8 hours to anywhere between 60 to 90 minutes, and also has the added benefit that should someone say, whoa, my intent matches up with, I did have the intent of having this session, but for whatever reason there's a, as of until that point, unforeseen traumatic association or something comes up that is just overly distressing. We have the ability, if it goes beyond red line into danger zone, to titrate or to end the experience, because we are administering this in an intravenous model. So if it does get into that place where it becomes quite apparent that it's not therapeutically useful, we can say, hey, fair play. We can readdress this some other day, but for now, let's just get you to a safe place.
That makes a lot of sense. And I've had similar thoughts that DMT has a lot of advantages over some of the other classical psychedelics. The main one being the much shorter half life, and your ability to prolong it as well. Like you said, if you want to, and if it's result if that results in progress for the patient. So I'm really excited to see you guys working with DMT. I think it's long overdue.
Mhm.
I've seen from your website that you filed for at least 4 different patents. What do those cover?
Yeah, so those cover, ultimately DMT is at this point generic, right? So
Right.
what we're seeking drug approval for is the specific utilization of DMT. So there's a specific dose delivery curve. And so the pace at which it sort of comes up into peak therapeutic experience, the duration of that experience, as well as the specified indication. So ultimately, for all these things, you do have to prove it out that it is both safe and effective for the indication that is noted as your target. So we have provisional patents with regard to that. And upon approval of, upon the completion of our clinical trials and proving that out, that specific dose regimen, the range that encapsulates that, we're looking to translate that into another potential area of IP, which is the actual delivery technology. Ultimately, yeah, this is a very specified dose delivery curve with certain time thresholds and peak dosage values. And that needs to be encapsulated into a drug delivery technology. So we remove some of the difficulty and barriers that physicians will have so that they don't have to, in the moment, continue to dial in or dial up dosages. But rather, we give them a really easy to use a set of tools that could deliver this in accordance with the already accepted and provisionally patented model.
That makes sense. So you had mentioned earlier your scientific advisory board. They have a bunch of notable names there from Johns Hopkins and Imperial College of London. Can you tell me more about the extent to which those researchers have played a role in the work that you're doing or will play a role?
Yeah, no, totally. I think people will know that there are certain specializations that these various people have. For us, in the development of our first ideations and validations, there were a lot of options on the table. It was, psilocybin, so research chemicals like 4-ACO DMT. There are a number of chemicals that were, potentially useful with regard to facilitating that change. But yeah, they were really informative in validating some of our presumptions and then helping us hone in on DMT as being sort of viable use case. And then from there, there's been certainly consultation that has directly informed the development of our protocol with regard to how best to deliver DMT. I think some of the parties, Robin Card Harris and Christopher Timmerman, have some sort of in the field, sort of in the trenches work there. And so they're very useful in informing that, and they continue to inform that on an ongoing basis with regard to the DMT delivery, as well as some other ventures that we're looking at that might aid and assist in the actual delivery of the DMT. And then Matthew Johnson, of course, was there from the starting, from the early start as well. And of course, understanding his background in psychology has been really instrumental in forming the actual therapeutics involved. So it has certainly been a collective, and yeah, not just being sort of like titular or symbolically important additions. We're really blessed to have them sort of meaningfully involved in the sort of guidance as we sort of button down and further define sort of therapeutic protocols and specifics of the dose delivery.
That's great. So have any of your clinical trials actually started yet, or is it more in the planning phase right now?
Yeah, no, there are a lot of intricacies that go into administering someone uh, with a drug, and so we have signed a research agreement with the Center for Human Drug Research in the Netherlands. We have a unofficial start range of sometime in late Q3 or early Q4 of this year. So we have our IMP; it's a regulatory documents ready to submit. And then we also secured our GMP drug supply from a drug supplier in Canada called Cygen Labs. They're Health Canada's only Health Canada approved manufacturer of a variety of molecules, but for us, very importantly, DMT. And so, within a regulatory context, you can't just ask your street dealer, "Hey, can you get me some of that nice, not too yellow DMT, but make
Right.
sure it's real make sure it's real mothbally." Um, you can't do that. It has to be to highly rigorous standards. And so
Right.
yeah, that GMP certification is super important. And so all those building blocks falling into place, from a timeline perspective, we anticipate the first patient recruitment to happen in Q4 and completion to happen over the course of about a month and a half or 2 months. And then following that, there's a data room lock where we analyze everything and then, yeah, submit to regulators.
I'm curious to know how you plan to get the set and setting right in these clinical delivery protocols.
Totally. There are a lot of, and that's super important, right? I think like the psychedelic sector has talked enough about it where this can't be, cinder block, gray concrete room where you feel like you're in the gulag. So there are a lot of already existing clinics that have made considerations for that. For our clinical trial, there will be, it does have to be pretty rigorous and many variable factors sort of pulled out of it. That being said, making the clinical trial as inviting and as hospitable as possible while keeping it very structured to, very pure and clean data. That being said, I don't know if we've announced it yet, but we are working with companies that are interested in the modification of set and setting from a musical perspective, as well as, we recently invested into a American Ketamine Center network that is already getting a lot of great clinical learnings from previous experience in another ketamine venture that they started, but ensuring that that patient experience is optimized so that it is inviting, hospitable, warm, and does facilitate a sense of comfort. Because, psychedelics are an inherently, I know I do, anytime someone says, "Hey, do you want to do even like a casual dose of psilocybin mushrooms?" I go, really? Like, am I ready to introspect and dive into some stuff? And especially if you're suggesting, "Hey, do you want to have a potentially ego dissolving, hugely transformational experience where we're going to go through the catalog of your, defects, deficiencies, relational misalignments, etc." there is already a bit of an anticipatory, not dread, but anxiety that comes with that. So we're certainly working on ways to um, leverage already existing networks to get some insights there and develop technologies that will only further aid in that sense of relief and relief, safety, comfort, as well as potentially to sort of introduce challenge potentially. But that is a lot of stuff that is not yet disclosed. But yeah, absolutely looking at how technology might aid in assisting the patient experience.
Gotcha. How does the psychotherapy portion of these sessions play a role? Like, at what point is a therapist involved in, I assume it's some sort of talk therapy. Is that going on while the patient is having a psychedelic experience, or is it before and after, or how will that work?
Yeah, I think the really important part is the before and after. In the midst of a DMT session, there will be potentially some interaction, but it will be, hey, how's it going? It won't be like, oh, okay, so this image of your father, what do you think it means? Probably not that depth, I think. The ability to reliably communicate that will be maybe a bit burdened by just the awe and wonder of the experience. But certainly in the preparatory and the post therapy, it's super important. Like, I did self-directed, non-guided, personal DMT sessions, and I got a lot out of it. But there were times where, due to my lack of preparation, I was sometimes just in a place of almost psychedelic dissociation, as well as just in a place of awe in a way that was challenging to me that I didn't know how to integrate. And I think because we are working on inherently you know, fundamentally important questions about, hey, why do you not want to inhabit the sort of realm of existence sober? Like, what are the sort of emotional underpinnings? Like, what are your emotional baselines, your view of optimism or your place in the world or social connectedness? I do think it's super important, through combination of, general psychotherapy as well as cognitive behavioral therapy to get that context building, just so that you have some primary articles of investigational subject matter to build that context around which you have the intent to investigate going into the psychedelic session. Of course, the DMT delivers many truths and sometimes in ways that could not be pre-anticipated. I never anticipated having certain insights about my generational familial history, but they arrived just without having too much intent. But we do think that in that preparation phase, it is a great opportunity to frame some of those key issues, whether they're familial or based in sort of notions of self-belief or whatever. But also just from the perspective of trust building, right? That to send anyone into the wild is going to be a little bit, a lot to ask. I think there has to be a pretty crucial component of preparing someone, getting them in a position of trust where they can not only trust the therapist, but also trust the process and sort of be made aware of some of the, for a lot of people, some of the visual stimulus and emotional experiences that may take place that for a lot of people, they've never encountered in life. So super important prior. And then following the psychedelic experience, we all have epiphanal moments. I know I wake up at 3 a.m. thinking, aha, I've got something. But unless that is contextualized and integrated, epiphany can fade, right? And some might argue that a real epiphany and profundity has a permanence. But in order to fully integrate that into against the context that was already established prior, I think it's really important to socialize it, to develop language around it, so that ultimately we're trying to help people to reconstitute their understandings of themselves, right? So there is a huge opportunity following massively profound psychedelic experience where people like us, we might journal, think about it, and try to make intentions or whatever following. I think it's really a great opportunity in the post psychedelic phase to talk about it, integrate it, so that a person can socialize it back into their understanding of themselves.
Absolutely. Yeah. I mean, I've always thought that the amount of effort that a person puts into their psychedelic experience is proportional to the benefit that they get out of it. So I'm sure anything that can be done within the framework of your protocol to kind of draw that effort out of someone would be beneficial.
Sure.
I've also read some of your recent press releases, and I saw one that caught my eye. You're partnering with a company called Divergence Neuro Technologies to
Mhm.
basically hook patients up to brainwave monitors or EEG machines,
Really?
and then kind of combine the data from that with an app that somehow uses machine learning to predict, I guess, dose response. Can you tell me more about that? It sounds pretty intriguing.
Yeah, I mean, I could go on for hours about the possibility of what that entails. But yeah, no, for us, if we just think about it in terms of, this whole psychedelic therapy evolution is a more holistic approach, right? It isn't just like, oh, hey doc, I feel bad. Can you give me a drug? Okay, cool. And I'll report back in 6 weeks, right? The whole approach is, the patient journey for a psychedelic experience is a bit of a long form journey, right? And right now, there are sort of diagnostic tools in place to understand from that relationship building, hey, what are your specific nuanced reactions to certain stimulus? What are your self reported beliefs? What constitutes your worldview? And then getting that person in that psychedelic state where there is quite a bit of mystery, right? Like, when a person is under the effects of psilocybin or DMT, we presume there's something going on visually and emotionally, but like I'm sure you've experienced, there are ranges, a dose response between 1 gram of dry mushroom to 5 grams of dry mushroom, and even within that there are sort of almost waves of intensity and insight that happen, and difficulty versus overwhelmingly positive or euphoric experiences. From a brain imaging perspective, we think it's really interesting to get a more empirical, data driven view of what's actually happening, so that first we characterize what these different states of the psychedelic experience are, what different dose responses are in a 3 out of 10, a 5 out of 10, a 7 out of 10, what we envision the therapeutically useful range to be. And then understanding that, it is possible potentially in the future to have that technology dictate what level of dosage goes into that experience. But then also presuming that we can find a reliable biomarker for what a therapeutically useful range is in terms of power relationships between different brain areas. It's possible to modify that with additional therapies or sort of therapeutic adjuncts, but also from the perspective of safety, understanding, right now, a physician or a therapist will likely observe their patient and, sort of interpret their facial expressions, their bodily tension, and different things to ascertain if that person is in a place of relaxation, delight, apprehension, tension, etc. We believe that with EEG, we can get a more empirical signal about whether a person is underactivated, overactivated, in a therapeutically useful place, or in a potentially therapeutically traumatic or distressing place, and use that to signal to the physician if interventions are needed or if modifications to course are also needed. So that's saying a lot, and that's only really the tip of the iceberg. We do understand that even prior to the psychedelic experience, there are variances, even within a population, like an addiction population, where not all addicts are, it's not a monolithic population where all addicts have the same characteristics. We see the possibility of observable differences in that population constituted of people with more dissociative characteristics, less dissociative characteristics, more manic driven, more sort of gregarious. And yeah, so there are certainly variances that need to be accounted for that could potentially dictate the course of treatment to be prescribed, either from a psychotherapeutic perspective, but also in potential molecule selection, right? And that brings me to our other acquisition, or our other sort of working partner, that is Halugen. Understanding that, from a genetics perspective, there are people that respond better or worse to specific molecules and have a higher or lower propensity for negative adverse reactions due to, propensities for things like schizophrenia, as well as, psychosis. So, you know, understanding that there's a lot of patient nuance, that these are massively powerful molecules that are we're proposing being administered. So we want to give physicians the opportunity to make the most informed choice based on, as of yet or until now, sort of biometric information that wasn't yet applied to making these choices.
Gotcha. You mentioned safety and also Halugen Life Sciences, which is a company that Entheon acquired recently. I wanted to ask you more about that because it sounded kind of exciting to me. It sounds like they do like genetic marker testing to predict how an individual might react to hallucinogens. I was wondering, are there already any sort of proven genetic markers, or is this more of a sort of discovery type of goal that you have?
Yeah, I mean, those biomarkers are presumed on a pretty strong basis of literature to correlate with propensities for schizophrenia and psychosis. And I think with the serotonergic molecule sort of receptivity or intensity markers, that's certainly something that is, from a literature perspective, been validated. And of course, we want to provide this to, with every test that we deploy, there's an opportunity for us to back data aggregate and cross correlate so that we get, not just for us from a commercial perspective in developing these tools for people, but in a way that does contribute to the general body of knowledge that makes up science and understanding of this. As more data arrives and as more data is available to compare against other fields of data, as well as sort of experience data, we're able to see, further cross correlate and, for people that have suffered, and there are populations that have suffered from, disorders like HPPD, that's sort of persistent post psychedelic, sort of hallucinations and things. Applying that in that case and understanding, cross-referencing the sort of presence of certain biomarkers to see if there is a correlation. And so, yeah, it is super exciting to us, I guess, to have these, I guess, legs of the data stool upon which, we can start developing some safety standards that we think will be applicable not only to our own internal clinical development, but, across this, ever burgeoning or ever expanding world of psychedelic industry as well as research. So yeah, we're committed to sort of broadening the scope of science as well.
So do you plan to maybe apply like machine learning or data mining on this genetic testing to kind of correlate that with an individual's response to these psychedelic sessions?
I think we would be foolish if we didn't. If the data is available and, we have a whole variety of other data fields to correlate this against, we would be quite foolish not to. And so that's certainly it's an area that we're interested in. And we think there's a lot of really valuable insights to glean from that, that will ultimately benefit the patient. There's no shortage of people that need some sort of psychedelic treatment. And we want to have tools available so that before they, someone using the use case of someone with depression, in 3 or 4 years, right now, ketamine is available for treatment. Soon, psilocybin will also be available for treatment. There will come a point where physicians will have to make a choice, about, hey, is it ketamine? Is it psilocybin? Well, what are the measures in place to determine if a person is more prone to a serotonergic or a psychedelic based negative adverse reaction versus a ketamine based reaction? So we want to arm them with tools to make that choice.
That makes sense. So tell me more about the business model. I mean, you're pre-revenue right now. Eventually, I guess the hope is that the FDA and other organizations will approve your protocol, your therapies, but what happens after that point? Is it something that's proprietary at that point, or can every other company in the world basically rush in and offer the services at that point once it's been FDA approved?
Yeah, totally. That's a super good question. I think the psychedelic industry has to address that. From the perspective of, we're not trying to own DMT and prevent others from, delivering it. Like, I'm a believer in decriminalization and safe access, but ultimately, what we have patents in place for is a specific mode of delivery. And what we're trying to clinically approve is a specific, mode of delivery and a sort of dose range. We will ultimately need to encapsulate that into a very easy to use technology that we could then sell or lease to practitioners and physicians that would like to administer this. So ultimately, we want to arm them with the simplest to use therapeutic tool that we can conceive of creating, and then on an ongoing basis, sell them the sort of unitized drug product that constitutes a session. So we want to remove all of the barriers, all of the difficulty, and to also, I guess, assist them by adding layers to that technology, potentially using some of the technology that we just mentioned that might optimize that delivery, ensure safety, and give the physician a more clear understanding of, hey, what are they operating with, what are the dangers, and how does this technology address that? So that's our ultimate sort of business use case with the to be hopefully approved drug. But in the interim, like we just described, I think there's a certain unmet market need that currently exists and will further expand upon the inclusion of all these various molecules into an already existing and growing clinical network that currently exists within ketamine. And so, yeah, we intend to have earlier revenue products that will facilitate some of that physician choice that we talked about, and give these people, these professionals, tools that they could use soon in terms of making that sort of prescribing choice and ensuring that their patients are, in fact, going through a useful and therapeutic experience.
That makes sense. You mentioned mode of delivery a number of times. I'm just curious. I'm aware of some current research going on in Switzerland where they're talking about doing this continuous perfusion of DMT for up to 90 minutes. Is that the style of delivery that you guys are considering? I guess in the past, all of the trials were just a single injection of DMT.
Yeah, no, it's similar. I think there's certainly some nuances that the differences between the two, but yeah, I think there's some validation there. We've had this idea for a while, so it's interesting and validating to have another company come and propose the same idea. But there's certainly differences in terms of the application too. I think the trial that you're describing is for a generalized safety trial, whereas ours is much more specifically suited to a specific type of indication. So we're intending to get a signal for early efficacy. But then also, in terms of the clinical trial makeup, outside of just pharmacology, we are looking at a variety of other measures that we think will be useful to our data program. But you're right, the sort of continuous infusion model is what we're seeking to do.
So right off the bat with your first clinical trial that's planned in the Netherlands, like how many minutes will these first patients be under the influence of DMT, or do you not know yet?
I think I'm not the science officer, but it will be in a generalized range of between 60 to 90 minutes, I believe. There's
Okay.
still some flexibility and exploration of ranges beyond that. But we think that that is a sort of nice starting range. And from a pharmacokinetics and pharmacodynamics perspective, sort of ample time to determine some things.
Great, great. So I'm sure you're aware about the recent legislation in Oregon where they're basically decriminalizing really all drugs, which is kind of amazing, but psychedelics in particular. And they're setting up kind of a regulated system where certified centers will be able to provide psychedelic sessions. I'm wondering if you think this is a good idea in general and what the implications of that might be for psychedelic medicine, such as what you guys want to offer in the future if this sort of model kind of prevails for the rest of the country. Is it beneficial or is it competition to your company?
No, I don't see it as being competition. I think, there are, I think I mentioned earlier, ultimately, I think people should have access to the best medicines available. I think so. Restriction of that is an inhumane treatment of people. It's, I don't know who benefits necessarily. but it certainly doesn't benefit the people. I think, given the options that exist right now, there is an obvious sort of unmet need given current pharmaceutical interventions. People that suffer from depression and anxiety. I know people who've suffered from depression and anxiety for decades and are still, on a sort of daily regimen of receiving medications for that, and nothing materially changes. And I know people that used to suffer from depression that did a couple of ayahuasca treatments or ayahuasca ceremonies, or did a 5 gram guided psilocybin journey, and they are as happy as they've ever been. So I do think there is, um, you know, outside of just the question of availability or what constitutes a personal choice, I think the movement and momentum that we're seeing in places decriminalizing and legalizing is indicative of a big societal push that says, hey, we know it exists, we don't want it, it hasn't worked for us. And there's this sort of growing signal that, yeah, there's a new approach to this. And so, I think it's great that as a society, some of the misconceptions about psychedelics are being undone, to the extent that, society is making demands of legislators to say, listen to us, we want these available. And even in Canada, we're seeing people, the work of Therasil, where they're petitioning the government to use psilocybin for end of life anxiety, to treat people with terminal indications that want to, relieve themselves of these anxiety associated with that. And so I think it's great that there's a push. From a threat perspective, I'm not overly concerned. Otherwise, or ultimately, what we're trying to do is create a medical product for people with really life-threatening medical conditions. Um, you know, I think it's really important that, given the sensitivity of that, that physicians have an option in terms of having a safe, validated, safe, and effective thing that they have confidence in being able to prescribe. And so that's our work. Our work is to service that population in dire need, so that eventually we can get to a place where hopefully there's some insurance coverage and increasing access to people that are in need of these options, but might not even be comfortable, or might a doctor might not feel safe in prescribing. Say, hey, go see this guy. He's going to give you 4 grams, and you're going to sit in the dark with him. We ultimately need to create something that is life saving, and physicians will have the confidence to prescribe.
Sounds good. Yeah, I agree. Um, all right, so last question. There's some people in the psychedelic community that are kind of opposed to this whole idea of corporations basically commercializing psychedelics. They kind of view that as like a misappropriation of sacred medicines or cultures. I'm not one of those people, but what would you say to critics like that?
No, totally. I've heard those arguments, and I think, the whole psychedelic space is comprised of so many stakeholders, right? And I think people that make that argument come from a place that is totally sincere. I think the last thing they want is for corporations to own molecules and sort of prohibit the use of them unless someone pays an exorbitant fee. But I don't think, in terms of the actual emerging reality, that will be the case. Try as they might, companies might try to patent specific utilizations or specific methods of manufacturing to arrive at a defensible product. But I think, from a societal perspective, there are always going to be medicine people. There's always going to be a gray market. There will always be access to these things. But yeah, I don't think that the presence of, we saw it in cannabis too, right? With the emergence of licensed producers, it didn't stop the gray market. But what it did increase was awareness and acceptance of it. So I do think, as much as there are different stakeholders that have different beliefs about, ownership of the sort of the spiritual, etc. Ultimately, we are in the same boat. It's a big boat. Sometimes the weighting can go one way or another, but we are ultimately in the same boat, where we collectively need to validate that these things are safe and effective. And I think, as so the tide rises for pharma and biotech validation of safety, that only makes the argument easier to make for the people in the sort of recreational, spiritual, and shamanistic space to say, hey, we have a right to exist and we provide a specific service. Ultimately, it does come down to access, I think. for us, we are trying to create something that will eventually be insurance approvable. And also creating a product where the individual, never mind the physician, will have some, there are cultural issues sometimes where I know that there are people that have very apparent need for, what we might deem spiritual medicines, but I guess this certain specific spiritual lexicon or the cultural incongruity with maybe a Judeo-Christian upbringing puts them in conflict with the idea of, the sort of language and tonality of things that are rooted in, culturally divergent spiritual practices. So yeah, we're trying to provide an additional entry point for people that need the medicine to access it. And I'm so happy and, appreciative of, I guess the other half of the argument that they provide that for people that, are able to access it, find it, and are comfortable with those sort of cultural practices.
Makes sense to me. Well said. All right. Well, it was great talking to you, and I hope maybe we can follow up with you in the future after you have more data from your clinical trials. And I wish you
So
the best.
yeah, absolutely. Yeah, I'd love to keep you all in the loop. And yeah, cool first interview. Thank you, Gordo.
All right. Thank you. So
Okay,
long.
man. Oh, and if I could just say, we are trading on the Canadian Stock Exchange under the symbol ENBI. If you're at all curious, please find us at entheonbiomedical.com. Follow our socials, sign up to our newsletter. We're in the early innings, and I think there's a lot of really cool technological and sort of scientific advancement that we'd love to have you all aware of as we sort of make it and yeah, make it publicly known.
And I'll put links to all their social sites in the video description and probably display them on the screen as well. So sounds good. All right. Thank you.
Thank you, Gordo. Take care.
All right. Bye.